The International Metabolic Physicians Association IMPA was formally launched with the lighting of the lamp at the hands of well-known business tycoon Dr. Niranjanhiranandani at the first day-long conclave on metabolism held on the 13th of January 2024 in Mumbai. Over 350 practicing physicians from across the nation witnessed the launch of IMPA by participating in a conclave. IMPA is an association of the physicians engaged in practicing metabolism which comprises health issues such as diabetes, obesity, and blood pressure and fatty liver disease. The idea behind forming the IMPA is to provide a unified platform to address the growing healthcare burden of metabolic disorders. The association aims to engage experts from multiple medical specialties. IMPA facilitates collaboration among these disciplines to provide holistic care to patients. IMPA aims to keep its member physicians abreast of the latest through education programs and courses so that they are equipped with the latest know-how and skill sets to treat the patients with metabolic disorder effectively. The chief guest at the launch occasion, Dr. Niranjanhiranandani, drew attention to the unfortunate fact that India, known as the capital of diabetes with 13.60 crore population in the pre-diabetic stage alone, faces a huge challenge. This is India's problem, hence we should not wait for and depend on countries like the USA to find the solution for our problem. As you know well, our country is excelling in many fields, be it infra, green revolution, technology, or space, so why not find a diabetes solution? The day-long conclave attended by the physicians across the country addressed a range of topics that included obesity and NCDs, lifestyle changes with diet and exercise, diabetes and metabolism, heart failure, fatty liver disease called MASLD, and its management, and endobariatric in metabolic disease. IMPA will integrate guidelines, formulate region-specific best practices with the help of homegrown research, and offer practical hand-holding for practitioners to cater to the need of metabolic medicine.
India is considered the diabetic capital of the world. We all understand the difficulties in terms of diabetes, all the complications that it entails, shortens lives, brings about debility, morbidity of all the organs of the body, and unfortunately, a lot of people's lives are shortened because of diabetes. Today, that conference that we have held is to look at this thing and stare it at the face as to what are the solutions really to take care of diabetic care. We in these hospitals, whether it's Dr. Hiranandanani hospitals or all the other hospitals which are there in the vicinity and all over the country, are focused on taking care of diabetic patients. The paradigm is already happening. We have better medicines, we have better care, but diabetes is not sufficiently taken care of by medicine alone. It requires a lot of care by the patient themselves to take care of their diet, take care of their exercise, take care of their lifestyle completely. All this can be done in India because we have more diabetic patients than anywhere else in the world, and we really need to focus on this subject. So I'm happy to say that this conference here today is focusing on the issue of metabolic problems in this country, and I am certain that with the leadership that we have in the medical fraternity, we will find solutions to diabetes in India. We have to. We have done care of so many other complicated diseases, and we have relied on the Western world to do it. But as far as diabetes is concerned and metabolic problems, the other countries are not so seriously affected. We are much more seriously affected. Hence, my congratulations to the hospitals which are doing all this activity over here, and hence they must be complimented. But we need to move ahead much more on the research in these areas in order to find a solution to the problems, not mitigation of these issues.
Sir, one more question I have, a couple of questions. Obviously, the second part of the question is that obviously body like IMPA has now come into being. So how would they carry forward this?
So IMPA is definitely committed to this issue, and I'm sure they will answer it better themselves. But the idea basically being it's a problem of the country. Each and every one of the citizens are affected. The leadership of the country is affected. All these problems are affected. Look at the time of COVID. It was those patients which were affected by diabetes, which had higher level of deaths in the country. So hence the complications which have taken place are multiple in terms of all those activities. Hence the care to be taken in terms of whatever it is much more serious. As far as the fellowships and other concerns are concerned, I think the focus in our hospital has been on diabetic and metabolic care, and we are much more focused in the last 18 months or so, where we have taken it as a prime objective in order to see that diabetic care, metabolic care is heightened to the extent to which we believe that we want to create centers of excellence. And I would really call upon all the other hospitals to do the same, because it's not just one hospital that is going to do it. It's government hospitals, private hospitals, municipal hospitals, institutions, research centers of these pharmaceutical companies also need to focus on that part of it. And I think we will succeed. We will and we shall.
Yeah, Brendan has a question.
Sir, this is Sachin from Global Prime News. I have a question. What are the key takeaways of this today's first conclave of IMPA? So what are the key takeaways for the patients as well as for the physicians?
I think it was, up till now, we took for granted that it is okay to have bad diabetes. People say, चलता है, सबको diabetes है, मुझे भी है, इसको भी है, इनको भी है, डॉक्टर के पास जाते हैं, हम दवाई लेते हैं, सब कुछ ठीक हो जाएगा. In reality, that is untrue. The focus on today's conference, the focus in our hospital is to enlighten the patients, to signify to each and every one of the citizens of India that if your family member has diabetes, let's take care. There is a solution. There is a solution to the problems where you can mitigate this issue of diabetes. Take care of your relatives, take care of your parents, take care of your siblings, take care of your children, take care of your grandchildren, take care of all of them. We can solve the problem. That is the most focus area in this, what we are doing. Our hospital, as you asked before, the Hiranandani Hospital is now taking care of creating processes which we can do. The Hira gain that we really need to do in terms of taking off all these problems to do. Weight loss is becoming a very important thing. It sounds sexy that to become losing weight, but it's so important for a diabetic patient, not only from a point of view of looking good, but actually to take care of their diabetes. I think all that is extremely important today.
Yeah, do you have any plan for diabetes? Speed and expect something? Which plan?
I don't like to show off, but I must tell you that Dr. Hiranandani Hospital does Hira Gain entire set of processes and procedures we have already laid, and I'm sure that the other hospitals and doctors will also take advantage of the things which we have done. We are open to share our ideas and thoughts with other people and really prescribe all these thoughts to the rest of the other hospitals, the other doctors and the country. And this conference is actually going to be the cornerstone of starting this off.
Today is the launch of this IMPA. Dr. Bhattan, could you please highlight
Yes.
what is the objective of it and how it also is it the first of its kind in India or globally? Because IMPA, the name itself, International Metabolic Physicians, sounds very insightful actually.
Because we have, as sir was saying, we have a diabetes focused associations. But diabetes is not a solitary problem. Diabetes, obesity, cholesterols, and polycystic ovary, there are so many other things which go hand in hand. They are almost like cousins. So to tackle all of them together and face them head on. So that's why we have formed an association called the International Metabolic Physicians Association. So metabolism involves everything of this. And that's why we have taken this as an initiative. And as sir was saying, in Hiranandani Hospital, we have started a program called the Hira Regain. So regain your health. And we are tackling all these problems together. And this is first of its kind of a center and first of its kind of an organization where we are trying to tackle not an individual disease per se, but collectively we are trying to tackle this problem.
Will you go national soon?
So we have already have got our mentors are from Canada, from Germany, and we have got Dr. Anup Mishra from Delhi, Arya Sharma from Germany, and Dr. Larry Cheskin from USA. So we are already having members who are from all over the world, and we are going by strength, because this is the first conference where we have people from all over the country. Dr. Neeta Deshpande is a stalwart from Karnataka and Belgaum, and she is a well-known all over India, and she has joined as a member of RSSDI, which is a primary organization. So we have got people from all over all walks of life, basically all specialities. And we have people from respiratory medicine, nephrology, all sorts of things who tackle metabolism. So that is the idea of IMPA.
What is the member count, sir? How many members are there?
So now we have got members of around 370. And this is like first thing, the first conference, and definitely with the success of this, we'll increase the members in 2 levels. One is called as the faculty members, where permanently they will be like for education and collaboration, and another are educating members. So they will get a lot of inputs from these faculty members, and so that they can implement that into their practice.
Sir, as far as the research is concerned, the research and the studies are concerned, so how good are it vis-a-vis globally? Regarding this, because newer researches, newer studies are.
So see, nowadays, because it's like a global village, we are getting all the research which is happening. India is one of the major centers of this research. So we get first hand. Nowadays it is not that something happened in America and now it is available in India. At the same time we get all the research material here. We are part of that research and we are evolving.
So any message for people for metabolism? Message? Yeah.
Well, the idea basically is that we can do it. There we need participation of the hospitals, the government, the doctors, the pharmaceutical companies, but mainly enlightenment of the patients themselves. Because there is so much disinformation about diabetes and the fact that it is okay to have diabetes and there is no need to really get out of it. I think this message is the most important message that we will succeed. Of course, I'm focusing on diabetes, but the entire range of metabolic problems is actually most important, but the general public knows it more as diabetes than the entire range of metabolism. But this association relates to the entirety.
Sir, I have one question. Sir, if you talk about cancer, the hospital which comes to our mind is Tata. So you think there should be some hospital related to diabetes or metabolic problems?
Yes, there should be focus on diabetes as a separate center. But what we are recommending, because the problem of diabetes is so prevalent all over the country, that every hospital should have a center of excellence in diabetes. You can't have 20 hospitals in India treating diabetes when 20% of your population has got diabetes. As it is difficult enough in the case of cancer, where everybody rushes to primary centers, city centers like Mumbai, Delhi, Calcutta, and all these other centers of where cancers are getting treated. But diabetes would be dangerous in order to have only few hospitals and centers. Every hospital in the country needs to have center of excellence for metabolic problems and diabetes in particular.
Sir, referring to this question, do we have the same kind of thrust or focus as the cancer has? Because cancer has been getting the due attention, but as compared to...
I'll give you a story. It's much easier to explain that than rather big numbers, and because the doctors are better at that. Let's give you one example. Those people who have diabetic and are affected by diabetic foot, by the time they come to hospital, 10% of them require amputation of the foot. If they come to our hospital, it will be 0.01%. So when you talk about super specialization, we are already in the field of super specialization in this field. But that's not enough to have it in Hiranandani Hospital. We want it to be throughout the country. Why should the percentage be 10% when we are less than 1% in terms of such things to be done? So there are many factors where within our control, within our studies, within our research, within our availability of knowledge in terms of treatment, we are able to save lives, save people from an amputated foot. So that's the big difference that we need to do. So while I agree there should be super specialization of hospitals doing only metabolic problems, I don't agree that it can be only a few hospitals in India which can solve this problem. We need to have centers of excellence in every hospital.
Fatness is a obesity.
Obesity has three issues. Obesity in terms of looking good, that's one. Obesity in terms of what are the consequences of it, that is, can be cardiac problems, which can be metabolic problems, which can be other problems relating to other diseases which are there. So I just heard a story where they said that if you're obese, even your eyes can get affected after some time because of the obesity. So what we are saying is obesity itself is a symptom which causes multiple problems. But in the metabolic field, it's a much bigger issue than in the case of other issues. So tackling obesity becomes necessary for everybody, but some people think of it as a cosmetic issue, and other people should really look at it as an issue to have good health and be able to live longer and healthier.
Sir, last
My question is bariatric surgery a solution to all the metabolic disorders and metabolic problems?
I'm not capable of, I'm sorry, I'm not
Sir, my
capable
last
of handling that
last
question.
is about the treatment, the therapies. Right now, this
You ask the doctors.
Wegovy, we have this Wegovy drug in the Denmark and all that. So, which is there in the news. So, what are the therapies available? Semaglutide is one of them. So, can you just
Wegovy
give
is
a
semaglutide, and Wegovy,
in India,
Wegovy has been approved by the Indian DCGI for use for
but
obesity.
how effective?
Yeah,
is it?
but then unfortunately it's not available. It is effective. It gives weight loss up to 15 to 20%, and the oral drug is not for obesity. It's meant for diabetes. So there are drugs which are useful and
Which are available and accessible
yes,
in India.
yes, some are available, some are not.
Which are
But
those?
they will soon be available because, as I said, the DCGI has already approved of it. However, one has to realize that we have to use the drugs at the right time for the right person. There's no one size fits all in obesity. You have to customize treatment.
Same coming to the question of bariatric surgery, is a solution for all the problems? I will say no, because the baseline is your lifestyle. Whether you do bariatric surgery, you do whatever, you have to still maintain the lifestyle, and that's where our thirst is. Of course, pharmacotherapy will help you. These are adjunct to whatever you are doing. The lifestyle is the main thing which we are focusing on. Apart from, yes, there are a lot of comorbidities. If you have you can't lose weight with all the available solutions you have, then of course you have to do the bariatric surgery. But I think the major focus and thrust should be on the lifestyle change.
Yeah, in many patients, in spite of doing bariatric surgery, there is reoccurrence. Because if they are not maintaining the lifestyle, it is just like once again back to normal, back to same point.
And what about the fast food culture? Nowadays the fast food culture has become more eminent. So how to tackle this? Can you
hospital, but every hospital which should have a specialized center. I'm attached in Mumbai to both Raheja and Hinduja hospitals, and we did start off Raheja hospital as a specialty center, but today it's converted into a multi-specialty because again it's not right to focus on one disease. You will have cancer, you will have other diseases. So every hospital putting in effort, and as I said, amazing to see the kind of work that Hiranandani Hospital is doing. We're speaking about the fast food culture. I think one of the aspects which is already taken care is in the schools. And today we see policies in the schools where fast food is done away with. And I think that's the right approach because it's the younger minds and children which will not only accept those changes but bring about those changes in their own homes. And it's the reverse thing. There was a time that we used to tell our kids what to do. Now it's the children telling the parents as to go away with unhealthy habits. So I think that is a great strategy, and moving away just from looking at diabetes but focusing on the overall problem of metabolic disease and syndrome is probably the right way for making India diabetes free and a healthier nation.
Is already aware about it. However, the focus just now may not be on this. General health has been the focus recently by the Prime Minister in terms of seeing that health, taking care of this, of each bill there. I think bringing the attention through our association to the central government will become very important. That in reality, if we take care of metabolic health, diabetics and all, the number of patients who will have other complications will come down. So you won't have other problems where you have a loss of so many organs that take place just because you have diabetes. So a focus on diabetes through the central government movement is absolutely imperative. And as we said just now, education becomes very important to be able to educate people as to what they need to do and why it is possible to take care of their health, and metabolic care that we really need to do is not impossible to do so. But the government, of course,